Mr Fletcher, how are you? Have you read the latest Pfizer report from October the 13th, where it outlines the risks of the COVID-19 vaccine? I'll read out. So they acknowledge the side effects are severe allergic reactions, non-severe allergic reactions, myocarditis, pericarditis, injection site pain, tiredness, headache, muscle pain, chills and joint pain. They also recommend that the doctor asks any person that wants the vaccine if they have any allergies, myocarditis, have a fever, bleeding disorder, is immunocompromised, is pregnant or breastfeeding, has received another COVID-19 vaccine or has ever fainted in association with the injection. Now, I note that your letter on the 9th of March 2021 didn't actually necessarily encourage people or doctors at the time to outline all these risks. Are you going to put out another statement where you inform doctors of all the risks as per Pfizer's latest press release?
No.
You're not?
No.
Why not?
That's not our responsibility. As we've talked extensively in previous hearings about the statement from March, essentially what that did was set out existing obligations on registered health practitioners in the context of COVID-19.
Okay, because I've been contacted by health professionals who had their licence suspended because they said the vaccine wasn't tested thoroughly. Are you familiar with the product assessment report from January 2021, whereby it said on page 31 that there was a bunch of missing information in regards to the vaccine, use in pregnancy, use in immunocompromised patients, use in frail patients with comorbidities, use in patients with autoimmune or inflammatory disorders, interaction with other vaccines, long-term safety data. So why were these people suspended for saying that the vaccines hadn't been thoroughly tested or properly tested? And we can have an argument there as to the question of degree, but don't you think that it's important that you let your doctors and nurses know that they're allowed to highlight these risks? And I'll just note Professor Kelly today has said the vaccines are safe unequivocally without highlighting any risks whatsoever. Now, in any professional business, you have to outline the risks and the benefits. So are you going to let your practitioners know that they're allowed to highlight the risks without fear of suspension?
So what we've said, Senator, and I'll go back to what that statement said, was that we expected registered health practitioners to use their professional judgment and the best available evidence in how they were in their practice, and that included when providing information to patients and the public. And so, again, as we've previously talked in this committee, we, in terms of looking at that, there was always an opportunity where a concern was raised for a practitioner to tell us how they think they did that, use their judgment, use the best available evidence. Our reference points would be the guidance that was in place at the time, the public health advice, the advice from TGA, the advice from ATAGI, and then that was what was considered in terms of deciding whether any regulatory action was needed.
So the practitioners are allowed to highlight all of these risks without fear of suspension?
They're obliged to, Senator.
Yeah.
They're obliged to talk through those things, and as Mr Fletcher has mentioned, the ATAGI advice is very clear on that. All of the TGA advice is very clear on that. No one has ever said that side effects do not occur.
Well, you rarely mention it when you say the vaccines are safe. You rarely ever mention the
It
risks.
is always a risk and benefit equation, as you know, and that is the basis of my assertion that they are safe. But that does not mean that side effects are not discussed. In fact, it was there were training packages that were and part of that was actually going through potential side effects. And as other side effects became known, they were also added to that list.
Okay,
so I think what Mr Fletcher is talking about is a subtly different way of the way that AHPRA operates.
Okay, so let's go about qualifying these risks. I note that the Western Australia Vaccine Safety Surveillance Report, which is one of, as far as I'm aware, is the only state to actually release the 2021 data, has a rate of adverse event per 100,000 doses of 264 per dose versus non-COVID vaccines of 11. So that is a factor of 24 times per dose, and given that you need 2 doses at least to be fully vaccinated, that's a rate of 50 times higher than other non-COVID vaccines. And I'll note that on page 8 that the number of people, the percentage of those people who reported a vaccine injury, 57% of people went to hospital, 48% went to emergency, and 9% stayed in hospital overnight. Now, given that that's a very high adverse event rate compared to other non-COVID vaccines, is that something that you think you should advise your practitioners to be aware of as well, in order to qualify the risk, which seems to not want to be qualified when we promote the vaccines or talk about the vaccines?
Senator, with respect, I think those are things really to take up with the TGA and with myself rather than Mr Fletcher.
Well,
He's made it very clear what
with respect, I'm not speaking to you,
to.
Professor Kelly, and the reason why I'm raising it with Mr Fletcher is that there's a culture of fear among the health practitioners about discussing the risks of COVID vaccine. And I want an assurance from you that this culture of fear is going to end.
Well, again, Senator, what I would say is that any of the expectations that we've set out, and I'll reference again to the March 2021 statement, simply set out what the existing obligations were on practitioners, so no new obligations, to use their professional judgment, to use the best available evidence, including when providing information to patients and the public on social media, but also obviously in terms of their interactions with patients, to help patients make safe and informed choices. So I think that is a constant.
Okay, thanks, Chair.
Authorised G. Rennick, LNP Chermside.